Women in hard-to-reach areas have it tough to access basic health necessities. Such include their reproductive health rights. Among such women is Charity Antonio. The 20-year-old mother of one stays in the area of traditional authority Chiromo 2 in Chikwawa district. To get to the nearest health facility, she has to cover a distance of about 25 kilometers. Such is the reason why during her pregnancy she didn't take part in prenatal care, and after giving birth, she didn't take part in antenatal care either. For those who brave the hilly distance to the health clinic, there are a number of challenges they have to put up with, including a possible encounter with deadly animals in the forest. Charity is among several women in hard-to-reach areas who have no or limited access to reproductive health services, which include access to contraceptives. But there is some good news for such women. The introduction of a new product in reproductive health care, Sayana Press. Sayana Press is the family planning product which experts in the reproductive health field think would address the distance issue, thereby many women can have easier access to the contraceptive. Sayana Press is small, light, easy to use. It also requires minimal training for one to use, making it suitable for safe administration by women through safe injection. It is the first of its kind in Malawi. It empowers women on matters of reproductive health rights. It is a safe and effective contraceptive option which also promotes women's independence on decision-making on matters of sexual reproductive health. In Malawi, trials and research on Sayana Press were done in Mangochi district with 834 women, and experts have since expressed satisfaction on the outcome of the research.
I think it was well received and backed with extensive and comprehensive community mobilization. It proved to be quite successful amongst the women in Mangochi.
According to the 2013-2014 FP 2020 summary sheet for Malawi, 41% of women choose injectables as a viable family planning method. Unlike the traditional Depo-Provera, which demands women to move back and forth from the hospital, Sayana Press is comparatively less involving.
Most women stopped taking family planning because of distance. That is a barrier to family planning, and this product tries to address that particular barrier.
Sayana Press has been recommended by the World Health Organization in contexts where women have information, training and support. Well, lessons from Uganda, where women in some districts have already started injecting themselves, show that the product has no serious side effects and a number of women have embraced it. Again, the Ministry of Health in Uganda is making sure that these self-injectables are available in a remote location for easy access.
They have realized that even now they themselves, they discuss and they say, now this one has done me well, so this one is better. The side effects are not very intensive, though they are similar, but not intensive like a Depo.
For a couple like that of Charity and celibate Antonio of Chikwawa, Sayana Press might be the way to go. The recent demographic and health survey for Malawi estimates contraceptive prevalence to be 46%, placing Malawi as one of the countries with the highest contraceptive prevalence on the continent. With this background, the Population Reference Bureau says taking Sayana Press on board would help put Malawi on course towards the attainment of the United Nations goals on health by the year 2030.
Sayana Press is an added way that they can provide protection from pregnancies. I think especially for women who either don't have the time or it takes too long to get to a health facility, this is a great option so they can take control over how they want to plan their family.
Another worthwhile point to share is that for developing nations like Malawi, the price for Sayana Press has been reduced from $1 to 85 cents per dose. Winnie, Botha, MBC News.